Hello guys, welcome to another live video. Today it's going to be with the midwife. So if you have any questions, even if you're watching this on replay, make sure you leave it in the comment and we'll answer in the next live. I'm so excited to have with me midwife Titi Lokwe. Is it Titi Lokwe? Titi Lokwe, you have to let me know if I'm saying your name right. Let me just spin up here what we're doing today. It's birth stories with a midwife. It's going to be really exciting. If you have any questions whatsoever, make sure you leave it in the comment so that Titi Lokwe can answer it. She just messaged me and told me she has a client that is coming in at 12, and so in an hour, so we need to get this done, and it's exciting. Let me invite her to come in and we will get started. If this is your first time watching me, my name is Victoria. I'm a midwife, childbirth educator, birth coach, doula, all the stuff, pregnancy, and hi, Titi Lokwe.
It is definitely Titi Lola.
It's Titi Lola. I knew I was saying something wrong. So it's Titi Lola. Hi, Titi Lola. How are you?
Good. How are you?
Good. Guess what? Today,
What?
when I was making that flyer, I was like, you have the same name as my mom. But my
Yeah.
mom is Titi Lyle.
Oh,
She's not Titi Lola, but yeah, Titi, you know.
right.
It's a great name. What does your name mean, Titi?
Forever. Well,
La.
it means forever is wealth.
Wow, that's amazing. That's such a beautiful name.
Yeah. And how are you doing? How's back
I'm
home?
doing good.
Yeah.
It's Hamilton here, so it's dry, but it's nice. It's nice that it is a bit cooler in the mornings, but
Right.
yeah. You guys are in winter, so I'm not jealous at all. But
I'm in Philly right now, so it's not too cold, which is nice.
nice. Have you guys seen your first snow yet? Has it snowed?
Someone told me that it was a little bit flurry the other morning, but I looked on the forecast for this week, and I think Wednesday we're gonna get snow. So I don't know how much, but I definitely saw snow for Wednesday.
Wow, that's amazing.
Yeah.
Well, Titi Lola, let's get right in
Yeah.
our life today. And I'm going to have you introduce yourself
Yeah.
for people that don't know you.
Yeah. So my name is Titi Lola, and I'm a certified professional midwife, and I practice and accept clients in the Philadelphia area and surrounding areas. Just started my own practice last year, August, so that's really exciting. Thank you. I'm a baby midwife out here, but I've been attending births since 2016 in different settings, home births, birth center births. I was in Texas for a little while. I was in Maine for the state of Maine for a little while before coming to Philadelphia, and I've been here for 3 years now, or going on 3 years in March.
Wow. How do you like Philly?
I like Philly. So Philly is, well, Philadelphia inside of Pennsylvania is considered an illegal state, which I'm sure you know, right? So the laws and legislation around here is pretty it's nice to have autonomy over your own practice and create your own protocols around things, which I am very grateful for, because I know other states, they don't have that luxury.
You're right.
But yeah, but it's nice. But most people, like, I'm licensed in New Jersey, so I kind of like go by their rules ish. Besides VBACs, but everything else I honor. And that's what most of the midwives in Philadelphia do. They get licensed in nearby states. I'm actually looking into getting licensed in Delaware State, which is a thing.
Wow, that would be nice.
Yeah.
That would be really nice. You
Yeah.
have your people here, and just a quick shout out to all of them.
Hey.
Rachel, Lou Photo, BK
Hey.
Big Brother, Shawnimi. I shall actually let you say their name because I'm sure I'm butchering their names. Excuse me.
You can't see anything. Well, I can't see. The only thing that I can see on my end is the request that I put in and your pinned question, your pinned title. I don't see anything else.
Wow. All right. I'm sorry. I guess that's how
Hey, y'all.
Instagram works. Well, Sean Nimi said TT with a heart emoji, 4 heart emoji.
So man, I can't see, and like literally you, and I see us at the top, and I can see myself, and I can see your pin question. That's pretty much. I actually don't get on Instagram Live that much, so half of it could be that I don't know what I'm doing, and the other half I can't see what's going on.
All right, it's all right. I'm sorry. Well, let me ask you this, Titi. You've been practicing now since 2016, you said. Tell us a little bit more about how you got into midwifery. Why midwifery for you?
Right. So it all started when I was in high school. The high school that I went to, they broke up the departments, and the department, I don't even know how I ended up in this department, but it was a medical program,
Okay.
in a gateway. So the idea was that they would expose inner city youth to the hospital system so that we could have more exposure. And what happened was, I think it was like every month we would do a tour around the hospital on a specific department. So I believe the first one, like first ever off the rip, was general surgery. And I remember like walking into, like, it was a whole class of us, and we watched someone get surgery done, and it was like a man, something happened to his penis, and they were like reconstructing it. So that was, have you ever seen like Grey's Anatomy where they have like the alchemy? Yeah, it was like 13-year-olds like watching this man get a procedure on his penis. And I think we went somewhere else after that. And then the third rotation was L&D, was labor and delivery. So normally we meet up in a classroom, and then they would take us on tour, whoever the designated person was. And this time it was a midwife. And I remember us sitting in the classroom, and I was sitting on the side, and she was like talking about her profession. She was like, yeah, I'm a midwife and blah blah blah. She was a white woman. She was like, she looked super hippie, like she had her little clogs on and her little free flowing pants, and talking to us about like, what she does every day. And I remember like the wheels turning in my head, like, oh snap, like she does every day of her life. That's kind of cool. And then it was like that part, I kind of knew like, okay, this is something I'm interested in what she's talking about. And then she found the tour of the labor and delivery room and the whole floor, and I was like, wow. And it was the way that she was talking about people in labor. She was talking about like her profession. She was talking about like the other nurses on the floor, and I was just like, wow, like if I had to choose anything to do for the rest of my life, like it would definitely be this. And that's kind of where it started, right? And life kind of like took me on different paths, and I eventually settled in on becoming a CPM, right? Instead of going the more common route with going to nursing school, going to midwifery school. So, yeah, that's kind of what brought me.
Wow. That's a long time. Like from being 13, like that seed was planted, and see where we are today. That's amazing.
Right.
That's really amazing. Well, I see more people here. And I just wanted to say to everyone here, welcome. Shawnimi says you're the best midwife ever, TT. Guys, if you could let us know where you're watching from, just so we could say a shout out to where you're watching from. And also if you can just click on that heart button, that like button, so that Instagram can share us a bit more. All right. So Titi, now you're a midwife, and I know there's a lot of things going on in the US right now with midwifery and birth and COVID and all of that. What would you tell a pregnant woman watching right now, and she is trying to figure out like where to birth, whether in the hospital, birth center, her home? What would be your advice to someone pregnant and just wanting to know like what are options, what are her options?
Right. I think the first thing that I have to like mention, right, in all of this, like, yes, it is true that we're definitely pretty much in a crisis, right? We don't, like, as a country as a whole, we don't really have great statistics on pregnant people and labor and birth and postpartum and things like that. And then on top of that, we have like COVID. But even like with all of those nuances going on, like I think the advice will still be the same, right? It would be that explore all of your options and really pick up feel comfortable with. I don't personally think like being at home or being in the hospital or being in the birth center is for everyone. I don't think there's a one size fits all when you're talking about the settings that people could be in. But I definitely encourage people to explore all of their options, right? If you're going to have a home birth, make sure that you talk to all of the midwives in your community so that when you're about to make that decision, you know that you asked all of the questions that you had, you feel comfortable with this provider. And same goes with if you're going to go to a birth center, right? In Philadelphia right now, we don't have the best selection on birth centers. There's only like one birth center in like the closest in our area right now. So going into that is like a pretty much like a little tussle because you have to like do your inquiries really, really early in pregnancy to even have the possibility to have availability for you, right? And
Absolutely.
if you're going to pick a hospital birth, some people do feel safer in the hospital, right? For whatever reason.
You're right.
People feel like the hospital is the least safest option for them, right? But whatever decision you end up making, at the end of the day, the best situation is a healthy pregnancy, because if you have a healthy pregnancy, then your options are limitless, right? You could be anywhere you want, versus somebody that has any type of high risk situation in their pregnancy. They have a more of a limited and some of them is not self-causing, it's just genetics or just something that somebody lives with that doesn't allow them to have the option of being at home or at a birth center with a midwife, and they would definitely want to see somebody that's more higher up, right? Like an OB or a maternal fetal medicine doctor.
Absolutely.
Is not going to be empowering at all, or doesn't mean that your birth is not going to go the way that you want. It's just the groundwork that you have to do around selecting the practice that aligns with your philosophy and what you want to honor in your labor and birth and pregnancy.
Absolutely, Titi. I really love like that perspective, that balanced perspective, because I know I've seen people that are very like, nope, you have to just birth in the hospital and that's it, or like, nope, you have to have a home birth and that's it, or
Right.
nope, you have to birth in a birth center, and I just like that you're just open. Like some people can feel safer in the hospital and some feel safer at home, and also it depends on that pregnancy and the woman and her family and what she believes in. If you have a mom with epilepsy, she cannot birth at home. Like, no, it's too high risk to be at home. And on the other side, if you have a mom that is healthy and feels safe to be at home, and she's done all of her research and she has a great midwife, she'll do amazing at home, because that's what she feels, and she's done her research, and it's safe to birth at home for a low risk healthy women. Before I ask you the next question, I have some of my people here, and I just want to give a quick shout out to them. Joy Eto, welcome. Mama Kukon, Afro History and Travel, welcome. And Joy Eto says, yes, I feel very safe in the hospital. Absolutely. Yeah, and everyone has, you just know where you feel safer, and that's where you should be. But make sure you just do your research, make sure it's an informed research, make sure you're where you're listened to and where you feel cared for. All right, Titi, for the next question, I was going to ask you, you've been to lots and lots of births. I don't want you to give me a number here, but you could if you want. But I know that you've seen, in your experience, what have you seen that really, really helps a mom and a partner do very well, like cope with labor? What are some of those things you would say?
Yeah, I think the biggest thing, right, outside of like making sure that your health check and you're doing all of the stretching and eating and all that good things, I think education is definitely the biggest piece that I find that when people don't know what to expect, like pregnancy for everybody, labor and birth is different for everybody, right? The sensations are different. What triggers them is different. How their labor unfolds is different. It's a piece of it, like when you know what to or kind of like the stages of labor or what your body is doing during labor and why this feels like this. And, you know, the closer that you are to baby, why are the contractions so much more intense versus in the beginning of labor, right? Having education around like the good coping mechanisms and, you know, how your partner be involved and, you know, what baby's experiencing while they're going through all of this is definitely really, really important. Like going to a test and not studying for it. Like there's a chance it might pass, right? Because if it's multiple choice and you just do
You're right.
fill in the blank, that's cool, right? But if you go to a test and it's fill in the blank and you didn't study, then most likely you're just going to be coming up with, you know, just anything off the top of your head. I definitely do.
Absolutely.
Really, really important. And then next to that, it's the preparation part, right? So that's the eating right, sure that your adrenaline is there and you're able to cope with what's happening and making sure that your body is fueled so that when you're in this state of labor and birth, your body is not, you know, I don't want to say failing you, but it's in cooperating with what's happening, right? Because, you know, we see it all the time in the hospitals. They tell you not to eat. They tell you, you know, just drink water and things like that. And if you think about it, outside of labor and birth, if a pregnant person were to do that, they'll start having headaches. They'll start feeling nauseous, the baby will start feeling some type of way. And it's like,
Absolutely.
right. And it's really interesting that in the hospital, you know, they say don't eat, don't do this, you know, bed. They don't really encourage movement, which I know out of hospital midwife that all of those definitely plays in a part of how your birth unfolds, right? If you're not mobile, not because like you're missing a leg or anything like that, you're just and you're just laying there, your body's not going to want to do what it's supposed to do because that's not labor and birth, right? That's not
You're right.
holistic.
Absolutely. Wow. I really love all the options that you gave. And those people watching, if there are other things that you did to prepare for labor and birth and you saw that really, really helped you, go ahead and leave it in the comments below so that other people can learn from your experiences as well. And if you're just coming in,
I
can you see things now?
I just see my request and the pinned title to the and I only see like I don't see any like it's just me and you.
Wow. All right. I'm sorry about that.
As long as you get to see it and you let us know what's happening, I think that's good.
All right. So yeah, let us know in the comment. I'll read it out so that Titi also can see it. Titi, I really like the things that you mentioned. You mentioned one, education. I feel like in everything in life, if you want anything in life, you get education because you need to know about that thing. And
Right.
with health, like people believe, like I believe in my midwife, or I believe in my doctor or my nurse, and I don't need to know anything about it. And guys, sorry to break this news to you, but no, even though we're the professionals and we treat you right and everything, it's still best that you know what your body is going through because we're there to support you and to help make sure things are going well, but you know what you're feeling. And sometimes if you don't know, that brings fear, and fear brings tension, and tension brings pain. And that goes, it's that cycle of pain, tension, fear, pain, tension, fear. I'm not sure if I'm saying the cycle right. And so I really like when you say education, get education. And now there's education everywhere. Online, there are physical
Book.
classes, there are group classes, there
Right.
are virtual classes. So you could get into classes. It is very, very important. And if you're watching today and you know someone that is pregnant and hasn't taken childbirth education, like it is so, so important. So maybe not even for them, but more for their husbands. I was just watching a YouTube video yesterday, and these my friends, they were sharing about their marriage, but somehow they shared about their birth, and the husband was like, yeah, I couldn't have been there because I would have fainted. Or the wife said it could not be there because he could have fainted, it could have passed out. And he said before he passed out, it would have walked out. And so I just felt so bad, like, you have a fear of it because you don't know about the process. You don't know why there's so much blood. You don't know why your wife will be in so much pain. But if you've taken classes, that's normal. that's needed for your baby to come. Contractions are needed for your baby to come. You know the blood is okay because, placenta needs to come out, baby needs to come out and all of that. You know what to expect, and you know how to help your wife cope in labor. And have seen in my experience that when moms and dads take childbirth education, not only does it click for the husband and the wife something, of course you learn something, even if it's your second, third, fourth baby. I also see the bonding in the couple. And for me, that's just something that I really encourage, I really support, I really want to see in my couples, because you go on from having this baby to being parents if it's your first child, or to being second time parents, and you need to be on the same page for this baby. And it starts in pregnancy. It starts with going together to antenatal, or prenatal, as we say in the US, antenatal here in Africa, and taking classes together and learning how to prepare together. It just builds the bond. It just builds the bond. So thank you so much for saying that. Go ahead, Titi.
And I was going to say, and it also allows you to be present, right? If you know what's happening and you're able to be that support person for the person that's laboring, right? Because
Absolutely.
you have confidence, okay, normal. And let's be honest, right? We put a lot of the power in providers like midwives, OBs, and nurses. But at the end of the day, if everything is normal and everything is unfolding the way that it's supposed to be folding, you don't need anyone. Really need someone is when something is going left, right? Because that's why you hire a midwife. That's why you join an OB practice, is so that when things is not happening normally, they're there to step in, right? And that's also good to have confidence in your provider to know that, okay, if something is going left and I'm in this vulnerable state, this provider is able to, make the best judgment on me and my family and things like that, right? But let's be honest, like, you could, as a provider, you could literally sit on your hands the whole labor and birth and just watch the person body unfold and give birth to their baby. Like, if you think about it, there's people right now, like, literally walking into a bush just to give birth to their baby and walking like it's normal, like, because it is normal. Labor is part of life, and it is normal. You don't need anybody unless it's not. And and unfortunately, it's just society. We don't really teach people, like, this is what pregnancy is like, this is what labor and birth is like. Because honestly, the crucial time is like when people are still young, right? Because you catch them at an age where they still have more time. If they choose to give birth, to get pregnant later on in life, they still have time to, build on that spark that started when they were younger. Like, this is what, even talking about menstrual cycles and periods and things like that, like, people don't know anything. Like, they just know that I bleed every so often and I may have cramps, I may not have cramps, may pass blood clots, don't know when their fertile window is, why they get period so often. Like, education is definitely like the most important.
Absolutely. Thank you so much for sharing that, Titi. It's so, so, so important. Let's take this to another level. So you do podcasts. You make a podcast. Tell us a little bit about your podcast. What is it about? What should people expect? I just was checking your Instagram page and I saw you on episode 15. Like, wow, I'm so proud of you. Tell the people a bit about it. Femi, welcome.
So the point of the podcast really started off with, I'm sure right? Like, as a midwife, as a healthcare provider, there's some type of like professionalism that needs to be like upholded when you're with your clients. And sometimes you can't, like, or I feel like within myself, right? Sometimes I feel like I can't explain something in a certain type of way because it kind of like, it might change the dynamic of the relationship, like almost being like too real with people or being really honest, where I'm pretty sure it's the Nigerian in me that I just can't hold back. I just have to say it. Like, it's like, if I'm thinking it, I'm going to say it. And that's what, right. Sometimes I'm not supposed to do that. And I always have to check myself, right? So the podcast was really so that people could get better, like, personal view of what's happening in my head when I'm talking about certain things. And And I know it reaches people in a different way, right? When we're in the office and we're talking and it's real professional and I'm just telling you protocols and explaining to you alternatives and explaining certain things. On the podcast, I really kind of like break it down in a further way where it's like a sister, like I'm talking to my family, like this is how I would want to explain family, this is how I would talk to them, right? Versus like clients that come in. So the podcast really just to talk about certain topics that are interesting people that I didn't have that much time to talk about in prenatals, or I didn't want to talk about it in that certain type of way. But yeah, and it's also to kind of make people understand human. I'm still like normal, and just because I'm a midwife doesn't mean that, you know, it's all work, it's all serious.
Absolutely, absolutely. And then you will have to tell them in a minute where to find your podcast. But I just wanted to say something to that. I really love that you're doing that because it's education, it's fun, and it is realness. And I feel like today one of the things that we're lacking is connectivity. Connecting to someone, and it could, I know, being a professional, it could become like, you know, I have to have this professional face. I remember one time a mom, during the birth, the mom was having a baby and it was just so beautiful, where how the dad was crying, the mom was crying, everyone was crying, and I remember I was tearing up as well, and something in me said, you can't do that, like, you have to be professional. You have to hold the space, but nothing bad was happening. It was just that the birth was beautiful, and I had to, you know, wipe myself quickly and hold myself up. But you know, it's just that realness, the connection. Like, I feel what you're feeling. This is beautiful. I'm human. Let's talk about normal stuff. Let's talk about, you know, and I just really love that you connect that way with your client, and there are people that need that, not just people, everyone. We need to be able to connect, and I love that you have another outlet where you do that, and where some of your clients and even other people that maybe are not pregnant but they're able to learn in a more fun, educative, and real way. Shanine says, I love that. And Elizabeth, welcome. Chioma Otu, welcome. If you guys have any questions for Titi or for myself about pregnancy, labor, childbirth, go ahead and leave it in the comment. We're wrapping up now. Titi needs to go to an appointment. And yeah, thank you so much, Titi.
Yeah.
Now, let me see the last questions to ask you, and then you have to go. I'm not sure what time it is because I can't see my time.
It's 11 right now, so we're still good on time. We're halfway there. I think like 55-ish. My clients, they're prompt. Unlike me, they show up, which I'm very appreciative of.
I love it. So can you tell them quickly how they can find your podcast, and then I would ask another question.
Yeah. So you can find my podcast on a few platforms, right? Usually I tell people, if you don't see it on any of my social media pages, definitely follow me if you're not following me. But it's on Anchor, right? So usually people just Google the professional midwife. So that's DA professional midwife. And you can hear Apple Music, Apple Podcasts. You can hear it on Anchor, like I said. Spotify is also somewhere that you can find me. Google Podcasts also, you can find me on there.
Yes, absolutely. And guys, if you're just following her on Instagram, she even posts like a link there that you could listen a little bit, and then you can go on her bio and she has more stuff there. Sassy, yeah, welcome. Let us know where you guys are watching from, and make sure you smash that heart button so Instagram can share this live a bit more so we can reach more people. Thank you, guys. All right. So now my next question is going to be a fun one. Tell me, I know there's HIPAA and all of that, but I'm sure you would just not share the names and where it happened. But share a birth that stood out in your mind that you'll never forget, a beautiful birth that stands out to you.
Ooh.
I know there are lots of them. But one that you will never, ever, ever forget because it was just so beautiful. So beautiful.
You know, so like you, right? In the beginning when I was attending births, probably like the first 20 births, I was a crier. Every time, like, it was it's just what happened. Baby was born, I shed a tear, and it was like amazing. So all births in the beginning seemed like all beautiful. All of the births are honestly beautiful. I don't know one specifically, but I know a theme that usually like makes me feel really good. Definitely the moms that are overcoming something, or they birth trauma in the past, or they were in a situation that they didn't really like or comfortable in. Those are definitely the births that are like very rewarding. They're all rewarding, of course. Especially any of my clients that's on this, your birth is definitely rewarding for me. Definitely people that are going through silent struggles that I know about, and they have this birth and it's like the birth of their dreams. And I think those are definitely the births that stick out the most to me, and those moms, that the families really that are dealing with things and they're able to kind of have this experience and hold on to this beautiful memory.
Yeah, absolutely, absolutely. I think one of the things about our jobs as a midwife is that we get to hold space for people. Sometimes I feel like we're not just midwives, we're also like counselors, and we're also like, I don't know, like sometimes I'm like, I need more qualifications for this, because
all of it.
I can advise you. Like, people come with their family problems, or they share about their marriage, or they share about like some trauma, and you try to like refer them to people, but then they feel safer with you because it's birth and pregnancy is intimate, and you're touching them in ways that only someone that is intimate, would touch them. You're checking, you're doing vaginal checks and things like that. And so you connect with people. And so when you know those things and you see them birth, it's really, really, really rewarding. Like you said, very rewarding. Before I ask you another question, I think that actually helps me to remember a birth I was at, and the mom was going through, what was it? I think it was sexual abuse. Not she was going through, she had like a trauma about it. And let me say this, sometimes you don't know things until someone is having a baby, and you touch them in a way and they're just like, and you're like, wow, what happened? In this case, I was actually not the primary midwife, but she had said it, she had mentioned it. And when she went through labor, it was just really hard for her the contractions were really hard. And I think it was just bringing a lot of remembrance of, not being in control. And I think she didn't take classes as well. Maybe that was also why it was hard. She wasn't in control of her body. And things were happening that were in that same area when she had the birth trauma. I wish we actually talk a bit more about this, but long story short, we had to go through a lot. And I was kind of like assisting the midwife. And I remember I had to go on Google and research quickly, like, how can you help someone, that's had like a past sexual assault, how can you help them go through this? And now I don't remember because it's been such a long time. And I had to say, I think I had to say something to her in her face, like, you got this. This is a good thing that is happening. You want this baby. This is good. And she looked into my eyes and I think it clicked in her mind. And she went for it. She pushed that baby out. She had that baby and she was so happy. And later on, she wrote to me and said, thank you so much for helping me go through this. And of course, I wasn't the only one there. And I remember she even had a doula there because we just knew that it was going to be a hard birth because of the other stuff she's gone through. But it amazes me how birth and pregnancy, labor, it can bring out a lot of things that you might feel like maybe you've gotten over. And it also reminds me a lot to face my fears, because if you don't face them, they'll come up in other ways. Like, they will come back in your face. So you need to face your fears. Exactly. Have you seen anything like this, Titi?
Yeah, definitely. Like, labor and birth is the most vulnerable time, right, in a lot of women's life. So it is very common for a lot of things to come up. And it is true that if you don't deal with it, if you don't confront your past issues, it's going to come up. It may come up. Some people, they're really good at it, things and putting it to the back of their mind, whereas some people, that's not their strongest point, right? So being in labor definitely comes up. But I find with people with past trauma, whether it's abuse, whether it's domestic, whether it's sexual, a lot of it is just giving the power back to them and knowing that they have the power during this very vulnerable situation, right? Because they're correlating this very vulnerable situation with other times where they were vulnerable and taken advantage of, right? And now we're in a new space where they're vulnerable again. So it's just really passing back to them and the power back to them. And those usually are the moms that you do the least with, right? You don't do excessive vaginal exams because they might not feel comfortable with it, regardless really a type to do a lot of vaginal exams, but definitely those are the moms that is like, catch your own baby and like, cope with what's happening, like figure out a place where you feel most comfortable and a lot of like playing around that. But I do advise people to see therapists and just so that they could deal with that before labor and birth, right? However that will come up for labor and birth for them. But I also know in the same breath, right? Like you said, we're multiple people, right? And I know, like in the States, that people have to come out of pocket to have some type of care like that, whether they want to see a therapist or if they have insurance and it covers it, then their therapist appointment isn't until like months later and things like that. So I know that kind of have that gap between seeing the appropriate people to deal with this trauma. But yeah, I do advise that though, seeing a therapist, talking about it, and just finding ways to kind of like overcome what happens. I was on Instagram and it was talking about like how people cope with it, and they say like, over time it starts to go away, and in the same post it was saying like how that's not true, that it's just the person stronger and deals with that differently, right? It's not like the trauma disappears. It's just that the has a better grip on it and is managing it way better now than they did before, right? They're more stronger now. They're able to kind of like talk about it. They're able to go through it and overcome it.
Absolutely, absolutely. Therapies are very important. I actually wish that we have like one that we work with, that we could just be like, no, see this person, I know they would they would help you. But personally, I don't even think I know like one personally. Maybe I have to do a better job to like reach out. So I have someone for my moms to use, Let me do a quick shout out to Sean. Oh my, Sean Eman. I hope I'm saying her name right, but she's been just an amazing commenter. She says she's watching from Shannon Hill, Pennsylvania.
Local-ish.
Okay, that's amazing. Okay, let's try to wrap this up with this last question. How are we doing on time?
It is 11:40 right now. Yeah, I can see can't see the time, but you can see the comments and the people.
So we're a team. You're watching the time. I'm watching the comment. This is amazing. All right. Can you share a little bit about just a little insider of how, like, one of your busiest day as a midwife, maybe with birth or maybe it was prenatal, that was just like, that was a lot.
Yeah, of course it's the days. So I have clinic on specific days, right? And yeah, that's usually how I do it. I'm usually in the office Saturday evening, Sunday, Mondays. That's why I'm here today. Definitely the days that birth kind of, whether I'm coming from a birth and I have clinic the next day, or if I have clinic and there's somebody brewing in the corner, those are usually the days like, ooh, this is a lot, right? And of course, like that, it doesn't happen often. It actually doesn't happen at all. It's only happened to us maybe once or twice where multiple people was in labor. But we have protocols around it and what we would do and how it look like. But definitely those days where everybody's deciding to have their baby and everybody has an appointment with me are definitely the most busiest days. But everybody's pretty understanding, right? And it's all about who needs me the most. Like, I'm not going, like, if a mom is in labor and I have clinic, like, I'm okay with hitting up my client oh, we're going to have to reschedule our appointment. There's somebody in labor, right? And everybody is pretty understanding. And also I make everybody understand that, like, even though like your appointment is canceled or whatever the situation is, one day you're right. One day, if you're in labor, I'm gonna cancel everything just so that I'm there with you with labor. So everybody knows that they'll have a turn, right? Whether you're in the receiving end of getting your things canceled on you, or you're the person in labor canceling things for you.
Absolutely, absolutely. I love that. I love how you say there's protocol in place. I think one of my it wasn't hard, but I think fun and busiest time I could remember was when we had, was it 4 or 5 births in 24 hours, and that was when I was still a student midwife. Like that was
Yeah,
a lot.
yeah,
That was a lot.
that definitely
And they
like some stuff, because that also happened to me too when I was in Texas. Like, we had like a month where it was just a lot of births, and it was like back to back in clinic, just because a lot of people were pregnant. And shout outs to those midwives that to take on that much.
absolutely.
I really don't like being too busy. Like, I like a steady, and I like not missing births, so I don't really take on a lot of people.
Absolutely. And I remember like we had like a prenatal the next day, and she was just so tired, and you just feel like I don't want to stand up. Like I'm just so tired. I can't do this. So on this hand, wrapping up, welcome to all the people that are here. Let us know where you're watching from. If you have any questions, we have like a minute or two to end this, but we'll really appreciate. Thank you for smashing that heart button. We can see. Thank you for the love. Titi, just to end this, how would you say women and their families can support their local midwives?
Yeah, definitely finding them is the first step, right? Home birth midwives, they have a tendency of like being under the radar and not really being that, have a presence in their community. It's a little Philadelphia, but a lot of other cities, finding a home birth midwife is like a journey, right? It's the start of the journey. Talking to people, trying to figure out who's there. Just because, I think a lot of midwives just believe that people are gonna gravitate to you, and it's not necessary to like buy a whole bunch of Google ads and have a booming Instagram page and things like that. So definitely finding them out and talking about it with other people as well, especially if you believe it and you understand like how somebody could be qualified to have a home birth and just to have a out of hospital birth, right? Some people are just super healthy and they're not married to the idea of being in the hospital, but they don't know that they have different options. It's always talking to people, right, about their options and what they could do and, what they have access to in their community. That's their biggest way to even help the birth is just talking about birth, right? I was talking about it the other day. Like, a lot of people don't know what to say to pregnant people, so they say like silly things and like things that are offensive, like, oh wow, belly is really big, or and say now, or like, things that is not that comfortable for a pregnant person to hear. Where like maybe we need to figure out more productive questions, like, everyone, like the assumption, right, when you get pregnant and you're showing is like, oh, which hospital are you going to have your baby, right? Like, maybe we could frame it around like, oh, did you see a midwife? Like, are you have a midwife, or are you gonna be in a birth center, or why did you choose this hospital? Like, and a lot of people are just like, oh, I chose this hospital because it's the closest, or I know one OB that's there and that's why I'm going there. And yeah, I think we just need to figure out better questions to ask pregnant people instead of like the basic kind of hurtful ones that people are already hearing now.
Wow, that's such a great perspective, and I would like that we actually have a conversation about that. I think I'm gonna make a poll on my page and have pregnant people say the questions they don't want to hear. And I like that you have this different perspective of like, instead of asking this, ask this, and questions that would actually empower and help people think.
Yeah.
And yeah, that's very important. Well, Titi, thank you so much. It was such a fun time
Yeah.
catching up again and
I,
just talking about midwifery and birth and labor and pregnant women. It's amazing.
yes.
Thank you.
Thank you.
And guys, go ahead.
Thank you for having me.
You're welcome. I see Maurice from New York. Welcome, Maurice. And guys, I just want to say, if you're new here and if you don't know Titi is a midwife in Pennsylvania. Go ahead and follow her on Instagram. She also does a podcast. You see all that information there. And if you don't know me, I'm a midwife as well. I'm also a childbirth educator. I'm so passionate about teaching. And also a doula. I'm right now in Nigeria. And so if you need any of those services, make sure you DM me here on Instagram. I'm also on YouTube. I share a lot of educational stuff about pregnancy, birth, labor on YouTube. So make sure you check my bio for the link to that. And thank you so much, all of you guys that were here today. We couldn't do this without you. We love you guys, and we'll see you next time, same place, 5 p.m. on the live show. Live show. Thank you, Titi. Love you so much. Have a great appointment.
You have a great day.
Thank you. God bless. Bye-bye.